this webinar. Today, as a speaker, we have with us a very special guest, Dr. Srinivas Marmamula, and he will be talking on topic public health as a career option for optometrists. Before he begins, I would like to give his general introduction. Dr. Srinivas is an Associate Director of Public Health Research and Training in Gulapalli Pratibha Rao International Center for Advancement of Rural Health. He is also a scientist and at Brinholden Institute of Optometry and Vision Science at the Prasad Eye Institute, India. I welcome you, Dr. Srinivas, on behalf of Mero Eye Foundation and all our participants. So now you can share your screen, sir.
Thank you, Solu, for your kind introduction. Good evening, friends. This evening, I'm going to present a topic, public health as a career option. I call this as road less traveled. I divided my lecture into 4 parts. I start off defining what is public eye health and what is the scope of public eye health. Then I'll briefly discuss about my journey of public eye health. Then we'll get into how do we get into public health if you're interested to pursue public health as a career option. And we conclude my talk with what are the avenues in public eye health. Let's start defining what is public eye health and what is the scope of public eye health. And people use different terms for same thing like public eye health, community eye care, community optometry, public health ophthalmology. All these words are used synonymously and all of them denote only one thing, and that is reaching out to those people who cannot reach you so that all may see, so that everybody will enjoy the gift of sight. So that remains the overarching goal of public eye health. To be very specific, public eye health deals with research to understand the burden of vision loss using epidemiological tools. It also involves evaluation of eye care service delivery models that are designed to address the burden of visual impairment. And most importantly, provision of services to those who are in need of these services. Look at the 2 images shown on this slide. Two of these people need eye care and they are visually impaired because nobody has ever reached them to provide care. Their spectacles are completely outdated. So public eye health is all about reaching out to these people. How can we reach them and many more like these people who need our services? That's what in a nutshell public eye health is all about. If you look at the global cause of vision loss, like what are the causes? Why are people visually impaired? If you look at the causes, close to 50% of the people globally are visually impaired because of uncorrected refractive errors. We all know refractive errors are a very simple, straightforward problem, and it can be addressed with a pair of glasses. But still, millions of people remain visually impaired because of want of glasses. More recent estimates, World Vision Report published in 2019, clearly talks about 2.2 billion people suffering with vision loss. And at least 1 billion people can be helped because their vision loss is avoidable. That means it can either be preventable or treatable. As you can see, uncorrected refractive errors cause vision loss in 123.7 million people, and presbyopia causes vision loss in 826 million people. You can see that optometrists can play a very important role in addressing these 2 conditions. Now, what is the scope of public health? Where do these public eye health people work? They work in communities. They work in schools with school children as a part of school health programs. We target occupational groups, especially the traditional occupations. We also focus on vulnerable groups, that is elderly in communities, elderly in residential care, children in schools, children in communities. And also there's always a focus on displaced populations, refugees, because these are more vulnerable group of people who are in need of eye care. In a nutshell, everyone who needs eye care come under the domain of public eye health. Let me spend few minutes talking about my journey into public eye health. I started my journey into public eye health about 1.5 decades ago. I work at Golapalli Pratibha Rao International Center for Advancement of Rural Eye Care, which is a public health division of LV Prasad Eye Institute. This is one division that takes care of several elements of public eye health. I especially involved in rural and community eye health. I'm a part of public eye health education and training. I'm actively involved in public health research. Other than that, I also help with capacity building, advocacy, policy and planning, community-based rehabilitation, and slowly we are also getting into technology and innovation for rural eye care. LV Prasad Eye Institute is a huge network of about 210 centers, predominantly working in 3 districts in South India and 1 state in Eastern India. We work predominantly in Odisha, Telangana, and Andhra Pradesh in southern part of the India. We also have small presence in neighboring state of Karnataka. I started my journey with Andhra Pradesh eye disease study as a clinical fellow in optometry. I started working in Andhra Pradesh eye disease study. At that time, this was one of the largest population-based studies ever done in the developing world. Designed with the main aim to understand the prevalence and cause of visual impairment, the study was conducted over 4 years during 1996 and year 2000. We had EPITS 2 during 2009 and 10, and in 2016, we finished the 3rd phase of EPITS 3. As EPITS was moving to different locations, the data collection for EPITS involved in 3 districts like Adilabad, West Godavari, Mehbubnagar, and Hyderabad. I went to all these locations over 4 years, and this is where I got inspired, and I thought, I think I should take public health as my career option during that time. And when I started my independent research, I did rapid assessment studies. And this is where I started my independent research about 10 to 12 years back. As a part of my PhD, I developed a new methodology called as rapid assessment methodology for detection of refractive errors. It's a simple epidemiological tool that is useful to understand the burden of refractive errors in the community. This was a low-cost tool, and this was submitted in August 2010. Rapid assessment studies have a very important place in public health research because these epidemiological studies are low cost. Because they are low cost, they can be repeated at regular intervals. They provide valuable data on the burden of vision loss in given locations. That's why a lot of people use rapid assessment methods. Over the last decade or so, we have done several rapid assessment studies in more than 12 to 13 locations in different areas. Most importantly, we were also able to publish these papers. As you can see, we extensively published from these rapid assessment studies. Even though the studies are of low cost, we were still able to publish papers mainly because we are able to maintain very high quality work. Most important to note is that all these research projects are driven by optometrists. And one thing that has given me a lot of satisfaction and a very good experience is the Tripura Eye Survey that we have done in 2016. When government of Tripura asked us to provide baseline data for the entire state, I was given the responsibility to do a statewide survey. So I traveled extensively in the state of Tripura and conducted a statewide survey. We published this paper very recently. We found that in state of Tripura, about 10% of the population above 40 years had visual impairment. Fortunately, refractive errors and cataract were the leading cause of vision loss, both of which can be addressed with simple interventions. I was also on technical committee for one of the largest programs ever done on eye health. It's a statewide universal eye health program launched by government of Telangana, the state where I live. I was on the technical board for this, and I guided the clinical part of this program. This was a very ambitious program. As you can see the numbers, 15 million people were screened, 4 million people were provided with glasses, and 1 million people were referred for next levels of care. And important thing is all these things have happened in 6 months time. You can see the way it was screened. To facilitate that big screening numbers, we developed a simple protocol called as basic eye screening test. This simple protocol can be used by primary level workers who can do initial screening, and then they can be referred to the next level of care where they'll be dealt by optometrists who can provide glasses as and when required, and all the people who need surgical care or medical management are referred to next level of care. The Kanti Velugu program happens to be one of the largest ever conducted eye care program anywhere in the developing world. Last 5 years, I've been focusing on elderly eye health. As we all know, India is witnessing a demographic shift with increasing proportion of elderly people. And also last few decades have witnessed a lot of societal changes and also attitudinal changes. Because of that, you no longer have a traditional joint family system, which acts as a support group. Now, most of the families are nuclear families or small families. Because of the societal changes, we see more and more number of elderly people, either they are living alone or living with spouse or also living in old age homes. Now, if you see in many urban locations in India, the number of homes for the aged are increasing significantly. And also more and more number of people are opting to live in these homes. And we all know that visual impairment remains a big challenge in elderly populations. Unless we address visual impairment in these populations, we will never achieve healthy aging. After all, healthy aging is equal to happy aging. And we really need to put systems in place right now so that we are prepared when we have more and more elderly people in the coming years. It is estimated that by 2050, every fifth person in India would be elderly. That means we really need to have very robust eye care and healthcare systems to address the needs of the aging populations. Going in this direction, in 2016, we launched a major project, longitudinal study on elderly population in residential care. It was called as Hyderabad Ocular Morbidity in Elderly Study, generously funded by Wellcome Trust India Alliance as a part of my fellowship. This is one study which we went beyond eye health. We all know that eye health is only one part of general health. There are many aspects that are important in elderly health that includes falls, depression, hearing, cognition, visual functions, performance-based measures, and all these are extremely important. We all know that vision cannot be studied in isolation. So as a part of the HOMES project, we're trying to understand the impact of vision on all these conditions, and also we are trying to learn what would be the impact of these interventions. If we provide glasses and cataract surgery, what impact it will have on depression and also visual functions. Again, important point to note, again, this project is completely led by optometrists. We have fantastic optometrists working on that who visit old age homes, set up the clinics, makeshift clinics, and do a very comprehensive, thorough examination in these homes. As you can see, all the procedures are done as a part of the HOMES study. Most importantly, we were able to publish the methodology paper last year, towards the end of last year. And then we followed up with another paper on visual impairment. We found that almost 1/3 of the people, elderly people living in homes, were visually impaired. And a large proportion of these people are visually impaired because of want of glasses. We also found that most of these people, elderly people, are falling because of uncorrected refractive errors and visual impairment. So visual impairment is not only related to visual functions, it's also related to falls. And now we are trying to see if provision of simple glasses can prevent falls in these elderly populations. We also did some work on population-based studies on elderly in state of Telangana. We published recently. We projected how things are going to change if no intervention is made in state of Telangana. And towards beginning of this year, January 2020, we launched this ambitious project, Vision in Eye Health in Occupational Group Study. Instead of Telangana, we were trying to understand how vision impacts different occupations and how interventions help them to overcome their disabilities and improve their productivity. And this was generously funded by Lions Club International Foundation. We completed the pilot study. The training was done in January. We did the baseline work. In March, we completed the pilot study. And then we had the corona pandemic. And all those things, whatever we're discussing, looks like all these things have happened once upon a time before corona pandemic. And we had to change our plans, and we have to change our lifestyle, and we have to change a lot of things. And the corona made many things difficult for us. And now we have something called as new normal, and expect the unexpected. So now you hear about social distancing, use of mask. Now you can't have people moving without a mask. People think it's a crime to move without a mask. It has become a new normal now. As Albert Einstein rightly said, the measure of intelligence is ability to change. This pandemic has literally changed many things on the face of earth. And eye care profession is no exception. We also need to change our practice patterns. We need to change our protocols. And as a part of this, when we started primary eye care and secondary eye care, immediately after the lockdown, which was there for 40 or more days, we had to come up with new protocols to address and also to ensure that safety is provided to patients. It's also safer for our vision technicians, optometrists, and doctors working in the field. We published this protocol as recently. And we also realized that many people are talking about barrier for different instruments like slit lamp. But we realized that not many people are talking about retinoscope, because retinoscope is an important procedure which our optometrists do in day in, day out. And we realized that we also need barrier for retinoscope, because many times when you do retinoscopy, you tend to go closer to the patients, and there's a risk of infection. So we came up with the idea of can we have a barrier for retinoscope so that our people who are doing refraction are not exposed for infection. Then we came up with a barrier for retinoscope. I'll show a small video on how this barrier is made. You can do it yourself, and you can use it so that you are safe while doing retinoscopy procedure. As you can see, a simple method which can be a very effective shield to prevent infection among people who are doing retinoscopy. Now, the next part is, now that you know that public health is important, and if you really are interested in getting into public health, especially for juniors who are at crossroads deciding what specialty I should take, what should be the right way forward, I'm going to give you some tips and also tell you how to get into public health. Now, many people ask me, why should I take public health? Why should I take community eye care as a career option? And because It's a new avenue in optometry. You don't have many people who are working in area of public eye health or community eye care. And most importantly, I feel public eye health gives you a job that is never same. Means every day the job is very different. Unlike your contact lens clinic or dispensing clinic or working in optical outlet, where you see things regularly. In community eye care, it is never same. It's different every day. And most importantly, I feel it gives you exciting opportunity to uniquely contribute to your profession. You're doing something for good of the people, and you get a sense of giving back to the community. And most importantly, you also feel that working with community and being a part of the social change, that gives you a lot of satisfaction because you'll be impacting the lives of people directly. And for many people, working in clinics year after year can be extremely boring. I worked in clinic for several years, but I always felt happy that I'm out of clinics because you feel bored after working in clinics for a few years. Public health also comes with some challenges. We travel frequently, about 30 to 40% of my time. I keep traveling to different locations. It's hard work because you never have 9 to 5 type of working schedule for public eye health. You work depending on the community need, depending on the situation. And also it is less fascinating, it is more of application of knowledge than innovation. And public health needs a lot of patience, persistence, and you really need to have passion to continue your work in public eye health. But you also have rewards. You get chance to visit new places, meet new people, have new opportunities, and most importantly, you'll be able to publish papers that will give you recognition, and you get a sense of satisfaction and also a feeling of gratitude, especially when you help people who are in need, who are helpless. Then you really feel that you are very grateful that you're able to help the people see. And this is a picture which we have taken in Rohingya refugee camps. Just before the pandemic, we are doing a program in Rohingya refugee camps in Bangladesh. As you can see, a gentle smile on this gentleman's face. You feel very happy that we are able to reach out to these people who are in need and we are able to provide care. It gives a very, very fantastic feeling. It's a very good feeling to help someone who is in real need. Public health gives you numerous opportunities to learn new things every day, experience the bliss, the blessings of the people, contribute to the community, contribute to your profession, also publish as a part of your research agenda. Now, question is, can everybody become a public health specialist? Or what are the prerequisites that are needed to become a public health specialist? So do you have it in you? Can you become a successful public health professional? So there is a checklist. We call it a litmus test. We need to see a checklist. And if you have all these attributes, then definitely you'll become a very successful public health practitioner. Let's see what is this checklist, and let's see, especially the young optometrists who are just graduating or who are in first 3-4 years of work after graduation. Look at this checklist. Do you like traveling to places, new places? Are you bored with your routine clinics, day in, day out, no change? Are you adventurous? Are you willing to take up challenges? Are you willing to make a difference in lives of people? Are you a team player? Do you work with other colleagues? Are you interested in taking a road less traveled, or you just want to go with the flow, one more dispensing, one more contact lenses, or you want to take something very exciting? Do you have the patience, persistence, and passion to bring a change in lives of the people? If you have all these qualities, I'm sure you'll become a very successful community eye health professional or a public eye health professional. If you are ready to take this journey of public health, you should take the first step. First thing is you need to upgrade yourself. The skills on biostatistics, the community eye care, epidemiology, whatever skill sets and whatever knowledge we get in our graduate level are not really sufficient for you to take the career of public health. You need to upgrade yourselves. Now, how to upgrade yourselves? There are ample number of opportunities. First of all, do you want to get into public health full time? So if you are interested in getting into public health and you say that, no, I want to practice contact lens, I also want to practice my clinical care, but I'm also interested in public health. Let me take part-time public health. I will do my clinics, I will also do my public health. Maybe that will be a good option to start off with. Once you're confident, that, okay, I can survive without doing clinics, I can survive without doing contact lens and dispensing, then you can move into full-time public health like me. If you're interested in part-time public health, there are many certificate courses that are available, live workshops that are being conducted now. Now, because of COVID, you see a lot of online courses that teach research methodology, public health, offered by many universities. And if you're really serious about public health and you come what may, you want to get into public health, you can take a long-term courses like MPH or MSc in community eye health, and you can take a PGDOIS, that means PG Diploma in Optometry and Vision Science. You can do internships and fellowships. This will make you ready to take full-time public health as your career. At LV Prasad, we offer a certificate course in community eye health. Now, from this year, we'll be offering this course online. This course will give you a very, very strong foundation to start off your career. Especially if you are a teacher in optometry school, or if you want to guide students on projects, if you want to teach research methodology or epidemiology at a bachelor's level, the optometry faculty can come and take this course, get enough skill sets to teach basics in research methodology to your students. And for those people who have got fantastic track record, who have got very good marks in their graduation, who are really passionate to take up this course, we also have scholarships available. Please write to me if you're interested. We are more than happy to provide scholarships to eligible candidates. And for fresh graduates who are really serious in getting into public health, we offer a postgraduate diploma in optometry and vision science. It's an 18 months program. You need to have a bachelor's degree to apply for it. Most importantly, we offer 10 subspecialties. Time is ticking, so 31st August is the last date to submit your application. So all the graduates, if you're interested, please do submit your application. Date is going to be coming very soon, and you need to take an online exam on 5th of September. It's a unique program. It's an 18 months program, 3 months of coursework, preparatory work, and then you have training for 15 months. The most important aspect of this is subspecialty training for 12 months. And we offer 10 specialties. In this, public eye health and community eye care is one. For those interested, we also have contact lens, anterior segment, low vision, binocular vision, eye health management, and if at all you want just comprehensive examination, you also have that option. And you should subscribe to this journal, Community Eye Health Journal, which is freely available. It's a very good journal to get started with public health. Now you also have an app available for this. You can go to a Google Play or App Store and you can download this app. Every month, nice stories are published. You get a very good hang on what's happening in different parts of the world. It will be a good journal to read. Other option for long term, you can also do MSc Public Health for eye care. This is what I've done after my optometry. It's offered at International Center for Eye Health at London School of Hygiene and Tropical Medicine. It's a very good course, 1-year course. A lot of people have done it. A lot of optoms have done it. You also have wonderful scholarships if at all you have got good track record. Again, you are very serious in taking public health, not only eye health, but public health in general. Then Johns Hopkins is the best place, I think. And this is where I got trained in. It's a fantastic place. It has really given an important turning point to my career. I learned a lot of things at this place. So if you're serious about taking public health as a career option, this is the place you need to go for. Now, you have done the course, and what are the avenues? Many times these young students ask, what is the future for public eye health? So what are the avenues in public eye health? As I shown you earlier, there's a huge burden of vision loss. And most of these people are living in rural communities. And that's where we are needed most. And employment opportunities, you can work in research institute as scientist. You can become a teacher, guide students. You can work in optometry schools and colleges. You can work with NGOs. I mean, there are many NGOs that are now hiring optometrists to lead their programs. You can work in hospitals. Most hospitals want to do some community work. You can also work in developmental organizations other than eye health also. You can work in universities. You can work in government programs. You can also freelance if at all you're really good at. Typically, the employment opportunities include teaching, research, services, you can also become a manager and manage eye health in a hospital. Now, whatever I told you whatever I told you, my journey about public eye health is only possible when you have a dedicated team. I'm very fortunate to have a fantastic team of people, which comprises of public health specialists, optometrists, vision technicians, data managers, a very fantastic team, always ready to take up new challenges. And because of this team, we are successful in getting very good quality data, which ended up in high impact publications. My guiding lights, my gurus, I was very fortunate to be guided by several eminent people. Dr. G.N. Rao has provided me with ample number of opportunities and helped me and inspired me to take public health as my career. Professor Jelkeef was my PhD supervisor. She taught me the basics and fundamentals of research. And Dr. David Fredman, my postdoctoral mentor, and he is responsible for me to launch my career as an independent researcher. And over the years, there are many more people who helped me all throughout my journey, and I learned a lot of things on the way. Just to conclude, two roads diverged in a wood, and I took the one less traveled, and all that made the difference. Friends, for juniors and for many people, choose a job you love and you'll never have to work a single day in your life. If you take a career option that you like, that you have passion for, then you really don't need any vacation. Every day you go to office, every day you work, that will be a vacation. You don't need a vacation leave as such. Thank you all for your patient listening. I'll be happy to take any questions. Thank you.
Okay, thank you so much, Dr. Srinivas, for such a wonderful insights. Well, now it's time for the discussion session to begin. Are you ready to take the questions, Doctor?
Yes, I am. Yeah.
Okay, we have a first question by Mr. Azad Saha. His question goes as, how much scope is there for public health as career option in government sector in India?
Government sector, I think there are a lot of opportunities, because even if you see the national program, you do have a lot of optometrists, and now more and more people are now planning to have optometrists in different sectors. I think optometrists have a very important role to play. As you can see by the statistics, more problems are there in the rural areas, and refractive error continue to be the leading problem. And there's definite need for these people to go to rural locations and work. So there's definite scope for optometrists in rural eye care.
Okay, we have again another question. You have shown the barrier for retinoscope, which is a good idea, but what about doing subjective refraction or PMT in patients wearing masks, which causes fogging of the lenses?
See, the point is you can just do subjective, but again, the point is you not be, especially if you have astigmatism and if you really want to correct to 6/6, you definitely want to do objective retinoscopy. Otherwise the patients will not be very happy. At the same time, we need to be safe. Our patients need to be safe. So we thought of having this barrier for retinoscopy. Does that answer
Okay,
the question?
sir, we have another question. What? Yeah, it does.
No.
Okay, our next question goes as, what is the prerequisite qualification required for taking public health course?
It's a very good question. I think many students also want to hear from that. See, what our bachelor's of optometry does is it will give you a platform to start off. So depending on your interest, you definitely need to go for higher education. For example, you can start off exactly how much passionate you have for. For example, if you can take up public health if you want to take, then we offer certificate course in community eye health. It's a 1-month program which gives you introduction to research methods, epidemiology, writing proposals, getting money, all those things. So you can try taking 1 or 2 courses and you see how you really feel about it. Once you feel, okay, I'm confident I can take up public health, then slowly you can start moving from clinical side to public health. Okay, because it cannot happen in a single day. Okay, when I started, I was a busy clinician. I'm a pediatric optometrist by training. I used to work 6 days in clinic because I was interested in public health. I started doing 2 days of public health work and 4 days of clinic. Once I was getting more and more handle on research, I'm able to learn new things. I'm able to become more independent. I did 2 days of clinic and 4 days of public health work. And then after a few years, when I feel that, okay, now I'm ready to take up public health as career option, I've given up clinics completely. About 10 years back, I think I seen my last patient. Of course, I see research patients, but I don't do clinics regular basis. So there are ample opportunities are there, but definitely after a bachelor's degree, either you need a certificate course or a master's degree to start off your career option. Public health as a career option.
Okay, sir, we have our another question, and our participants are asking for the registration link to public health course. Can you please share it?
Yes, you can see on the slide, you have my email address. Okay,
Yeah.
you can please write to me and I will arrange to send you the information related to all our courses. Not only that, any information you need regarding public health, you can always approach us. I'll be more than happy to help you out because we need more and more people in public health.
Okay, interested candidates can write to Dr. Srinivas for getting more information about public health course. Okay, let me check out the next question. We have next question by Miss Archana. She is writing to us, Sir, in Nepal there is a scope of public eye health, and is it good and safe occupation for girls as we have to travel source?
Well, it's a good occupation. I don't think gender will make a difference. Of course, you do have certain challenges being girls. You do have some challenges, but it still can be managed. And still, public health is a good option because public health means you. It's not necessary that you need to go to field every day. You can still manage projects. You can still manage teaching public health. You can still teach research methods. So you can still work. It doesn't mean that every time you need to go to the field. So women also, girls also can definitely take up public health as career options. I do have some of the PGD students working with me, girls who are very enthusiastic to take up these challenges.
Okay, thank you so much, Dr. Srinivas, for your answer. These are only the questions that have been raised by our attendees so far, and we will be waiting for just a few more minutes if anyone is willing to ask. Okay, I can't see any more questions. I guess we have answered almost all the questions till now. Considering the time limits, here I announce the closure of discussion session. And I would like to thank you all for coming up with your queries and making the discussion session more interactive. Also, I would again like to express my immense gratitude towards our presenter, Dr. Srinivas, for sharing his wonderful insights. Also, I would like to thank all the direct and indirect helping hands for the iTalks program. Before wrap up, I request our today's presenter, Dr. Srinivas, to share his few words to our program.
I think it's a wonderful idea because all these lectures given by eminent people are available online. It becomes a very useful resource for all the people who want to get interested in. I think while COVID has made things difficult for us, it also provided with ample amount of opportunities. It has forced us to change way we look at things. You look at online education, fantastic efforts by these Mero Eye talks, and I did listen to a few talks before, and several eminent speakers have spoken about it. Now you have a valuable resource of 100 lectures, and which can be used by anybody at no cost. So I think it's a phenomenal effort. It's a good idea, and it's very well implemented. And we should thank you on behalf of all the
Thank,
optometrists for taking up this important task.
okay. Thank you so much,
Thank you
Dr.
so much,
Srinivas.
doctor.
It's our immense pleasure.
Okay, so doctor, I have one query. I want to put one question here. So doctor, what you would suggest, like in optometry practice in a bachelor, that curriculum should be a subjected to learn the public health, because if we choose a career as a public health for our career, and what curriculum should be included in the public, optometry in the bachelor course?
I think most important point is we need to have teachers. Like if you know in India and I think probably in Nepal also, we have a lot of optometry schools and colleges. And you do have a topic called epidemiology, public health, biostatistics in your optometry undergrad course. Unfortunately, we don't have too many teachers. So what I suggest is all the optometry schools and colleges should have faculty trained in public health, and they also take up responsibility of providing eye care in nearby communities. If optometry school is there, maybe optometry school can adopt a village or two villages and provide care to these people. That way students will get a chance to learn new things, get into communities and understand community needs. So that way more and more people will get interested in. And other thing is that optometry schools, a lot of people do third year projects, fourth year projects. Again, because of lack of guidance, many of these projects never end up as publications. So we should try to see that the third year, fourth year students do wonderful projects, nicely guided, and they should end up as publications. So then only whole of optometry will improve, because optometry should go beyond cities into villages to provide care.
Okay, thank you so much, doctor. Doctor, what about the community health diagnosis? Like we used to practice community health diagnosis in our basic optometry practice as well. So is it, what do you think? Like, is it necessary to practice, or it's like it might be optional for us?
No, I think we need to see there is a basic minimum that is required, because the quality of care should be same. Even if you're providing care in remote rural location, there should not be any deficiency in quality of care we provide. So irrespective of ability to pay, irrespective of whom people we are treating, we should always provide good quality care. And definitely there is a need for having common minimum requirements to provide care.
Okay, thank you so much. So, Sulu.
Okay, herewith I announce the closure of today's webinar, hoping to see you all again tomorrow. Stay safe, stay connected. Thank you.
Thank you.
Thank you
Stay
so
safe.
much. Thank you so much, doctor. Thank you so much.